We are so glad to have you here. We hope that you are going to share a positive insight on harnessing the social media for the impact of the health initiatives. So in a few minutes, we are going to welcome Dr. Ntuli, who is going to share his insights. So before he starts, I would like to go through. Please mute your mic if you are not speaking. Participant. Okay, so Dr. Ntuli is Associate Public Health Leader with over 20 years of experience in health system management, reproductive health, health finance, and global health diplomacy. He currently serves as the Director General of the East, Central, and Southern Africa Health Community, leading health advocacy and collaborations efforts across 30 African countries. His academic include an MD from the University of Dar es Salaam, Master of Public Health from Tumaini University, and MBA in International Health Management from Swiss TPH. And he holds a PhD in Public Health Financing from the University of Dodoma. He has also completed advanced leadership programs at Aalto University and the University of Washington. Dr. Ntuli held a key leadership role in Tanzania health sectors, including director positions at the Ministry of Health and the President's Office, Regional Administrations and Local Governments. Notably, he oversees the constructions of over 3,800 primary health facilities, expanding healthcare access from 50% to 80% of the population. Among the pioneers of the digital health, Dr. Ntuli co-created a Mama emergency transport system, which has served over 500,100 lives and expanded across several African countries. He also championed Tanzanian Community Health Workers Initiative aimed to deploy over that workers and led the country of COVID-19 vaccination campaign to 95% covered rate. His leadership in outbreaking response, including COVID-19 and Marburg viruses in 2023 and 2024, has strengthened Tanzanian health emergency preparedness. Internationally, he has contributed to revising the international health regulation and shaping the pandemic treaty through the WHO Intergovernmental Negotiation Body. Congratulations, Dr. Ntuli. Dr. Ntuli, he also respected academic and mentor, serving as a senior lecturer at the University of Dodoma. He has also authored over 140 peer-reviewed articles and co-edited 2 influential books. Central and Southern African College of Public Health Physicians. He works to continue to shape health policy across the East African region and Africa at large. Congrats, Dr. Ntuli. This is a wonderful biography, and we are so glad to have you here on this meeting on the power of social media and health advocacy promotions and innovations. So we are all so excited. So let me take this opportunity to welcome you for that you can present, and later on the participant will have questions and also to discuss if there's any issues arise. Dr. Ntuli, karibu sana.
Thank you very much. Indeed, it's an honor and it's a privilege for me to participate in this very important discussion, which is around the social media. And now social media is one of very important tool that can be used to communicate various information from one place to the other, but also it serves as a transmitter to the number of information that needs to reach out to the public. So today I'm very much excited, and I must take this opportunity to thank the Moffat, the leadership, for having organized this very important talk that I'll get to share the experiences that I've had with the social media. So social media, again, is very powerful, and media can either make you or it can destroy you. So social media can transmit good information, at the same time it can transmit bad information. So we need to carefully use the social platform to be able to educate our society, to be able to promote health, to be able to advocate for a number of things. But apart from that, to be able to innovate, because the triangle of advocacy, health promotion, and health innovation, it can lead into improvement in the health outcomes as well as the well-being. So social media is very important, and I agree with those who are saying that it's not just about putting likes or dislikes, but it is a lifeline. Maybe if I may start now, I would request if you can share the screen. Can you share the screen, please?
Yes, we are sharing. This time around, we are setting something here, but we're going to share right now.
So as I've been introduced, my name's Ntuli Kapologwe. I'm the Director General of East Central Africa Health Community. This is a community that comprises of 9 member states. Next slide, please. So a bit of background. The East Central and Southern Africa Health Community, this is a regional intergovernmental health and a diplomatic organization that fosters and promotes regional cooperation in health among member states. But we also advocate for a number of policies. We also stimulate policy formulation and implementation. We were established 51 years ago and under the auspice of Commonwealth. So we consider Commonwealth Secretary placed in the region, and it's only a regional health organization providing support to the member state in the health-related matters. This is a vehicle for setting the regional health policy agenda and the regional standards. As I said earlier, we exist in a number of countries, including Eswatini, Kenya, Lesotho, Malawi, Mauritius, Uganda, Tanzania, Zambia, and Zimbabwe. Next, please. So our work goes beyond the 9 member states. We also exist in the Eastern, in the Northern Africa. We also exist in West Africa. So you can see that some of the countries, including the Sao Tome and Principe, we are in Liberia, we are in Niger. So those yellows, those are the countries where the EXA implements number of projects and programs. Those blues, those are the countries which are the member states. So in total, we exist in 30 African countries. Next. So why the health sector must embrace social media? And why now? Social media is widely used and dynamic platform presents valuable opportunities to influence and improve health behaviors. But also social media functions as a collaborative platform for disseminating health information, influencing target audiences. But social media can also be rapid and broad reach accurate health advice. If one wants to advise, you can quickly go through the social media and you should be able to deliver whatever message which you have within the shortest time possible. but also it helps in fighting misinformation at the scale. I remember during COVID time, there were a lot of misinformation, the infodemics, and that was pretty confusing to some of the people. So we used the social media to be able to clarify and to be able to make sure that this information are not taken by the public. But also it helps to strengthen the patient engagement and trust. Now we have community of practices. We have also community of patients. They open a WhatsApp group. They discuss openly the challenges being encountering, especially with chronic diseases. So social media can also be used to help in engagement and also building trust with the patient, but also enabling peer support and community building. So through social media, you can have communities through WhatsApp. We have now communities responsible for mental health, communities responsible with primary health care, number of communities. So through the social media, you can have several communities and you can be able to discuss and exchange knowledge and skills as well through social media platforms. But it also helps to monitor health trends and crisis signals. What we call health security, you can use this one, which is AI powered, to be able to monitor health trends and crisis signals just by using the social media platform. So social media can be widely used in array of things to be able to contribute to the improvement of health outcomes as well as the well-being. But also it helps to expand professional collaboration. I have been able to meet with a number of organizations whom we just interacted through social media. And through that interaction, it led us to have a meaningful partnership and collaboration. And it's cost-effective reputation building and outreach. Using social media is cheaper as compared to using the mainstream media. So social media can be used at a cheaper cost while you are transmitting a number of information as compared to the other media streams. But also branding of key health interventions. We have been able to brand number of health information through the social media. For instance, the M-Mama, the emergent transportation of women from the community to facilities or from facilities to facilities, that has been well facilitated and coordinated by the social media. But also we used to brand them to Human is Health. This is a social behavioral change campaign, but we use social media and people, they were able even to come up with Mtu challenge. So we have had a number of things that were branded through the social media. So social media can be used as a conduit to be able to communicate, to brand whatever product which you have. Next. So I thought I should quickly take through the three key terms that will be frequently used during my presentation. One is health advocacy. This is simply those actions and efforts individuals, professionals, communities, organizations take to promote equitable access to quality healthcare, but also to protect patients' rights and to influence policies and systems. And this is very important, influencing policies and the health system. So health advocacy is one of the very important public health tools for one to be able to make sure that the equitable access to quality health services is well promoted, the rights of the patients are intact, but at the same time, to inform policy formulation, to inform a system. So with this advocacy, one can use the hashtag to communicate whatever information that he or she wants to be known to the public. In so doing, the policymakers, implementers, they will learn that the community or individuals or professionals, they're interested with this thing. And that will trigger people to formulate policy, and that will trigger people to implement policy. So that's a very important thing as far as the social media is concerned. It can be used as a conduit to deliver health advocacy to the different population groups. Then we have the word health promotion. This is simply the process of empowering people to increase control over their health and improve it. And also, for it to be effective and to be well received by the society, you need to have social media. So that's why we said the power of social media in driving health advocacy, health promotion, as well as health innovation. And then when we go to health innovation, this refers to the development and implementation of the new or improved policies, systems, products, technologies, and what have you. Also, social media serves as the backbone for the health innovation. You can use this one to communicate with colleagues with whom you are innovating for a certain product, with whom you are innovating for technology or delivery of any services that has to be rendered to the general population. So these three terms are quite very important as they are part of the theme of our today's discussion. Next. So the role of social media in health advocacy now. I will start with advocacy, then I'll go to the promotion, and then I'll finish with innovation. It enables the patient and profession to raise awareness on the certain disease conditions or any or raising awareness regarding issues around service delivery and issues around perception to the treatment or perception to the services that is rendered to the people, the feedback. So we also use social media in that one. You can provide an online survey, the monkey survey, or you can use any other feedback mechanism that is unbiased so that you can have the feedback of the people whom you are getting the services. And social media is one of the best. Initially, people used to put these suggestion boxes, and you find that those who are opening the suggestions boxes are the ones who have been accused of mishandling patient and other things. But with social media, now one can give a feedback. And there are several ways on how people can give feedback. Now you cannot hide whatever you are doing in terms of whether the services you are providing is good or bad. But people, I remember we had the mMama campaign, we had a universal coverage campaign, neglected tropical disease campaigns. It was amplified through the social media platforms. People, they could see and understand that it is very important to know this. So this can also, as I said, is an important tool for advocacy. For example, we had Health for All, advocating for health for all, leaving no one behind. One of the slogans, which is resonating very well with the people. All for health. We had money is health. We had Fataki. Number of slogans that have been used to advocate for health through the social media. Social media has been saving, one can put the hashtag to be able to communicate whatever information is needed. Then health advocacy through social media can influence public opinion and the policy change. That's why I say you'll find people that put hashtag on whether they want to sustain something or they want to get rid of the undesirable behavior or undesirable practice. They put hashtag. And they collect up to say 10 million hashtags, and then people make decision out of that. So social media is one of the very important tools in advocating for anything, but you need to get it right. And it's where now the confusion is always it's always occurring, especially to the people. If you do not know how to go about this social media platform, whatever you want to advocate, then you might turn out to get the backlash out of that. So we have had the Mama, but a successful example of advocating campaign in Africa, for example, the Break the Silence. This was one of the big campaigns that was conducted in South Africa and most of Southern African countries, trying to fight stigma against HIV. HIV is one of the diseases that has been highly stigmatized in the disease history. So through advocacy campaign, it turned out that a disease like HIV was slowly normalized in the general public. Next. Using social media for health promotion. So preliminary evidence suggests that social media intervention can promote a health behavior change. That's why nowadays you find people are posting, okay, let us go for a challenge of drinking water 2 liters a day. Let us go for a challenge of walking up to 10 kilometers. And people that will be posting there. For instance, with Mtuniafia, Money's Health, what we did, we started the challenge that everyone should record his or her weight, body weight. And then after 6 months, we will see who have lost some pounds. But that should be accompanied with health, eating, physical activities, and other things. And people recorded for that. And people started to behave positively by promoting best practices for the health. And this is what we want. Campaigns that are conducted by WHO, CDC, now EXA is also to establish another campaign. The issue to do that with mental health and well-being. That will be the campaign. And also, we will you to be made aware of the best mental health practices that will make their mental health intact. And this is what we want. And the issue to do with lifestyle changes and also giving each other's challenges, it helps to promote health. And there could be no other single platform where a person can try to promote health apart from the social media. And the people now are moving slowly from the mainstream, they go to the social media. So user-generated content encouraging healthy behavior, like having the fitness influencers, the dietitians, they help a lot to promote health. Spreading accurate health information and fighting misinformation. So if there is any information like the anti-vaxxers, vaccine doesn't help. So we as public and global specialists, we come forward and say, no, these vaccines are very important and it has saved this number of lives, maybe in the duration of 40 or 50 years. So you can give clarity on number of issues through the social media. Engaging communities through health tips, awareness days. We have a calendar of awareness, which we commemorate a number of things across the year. And we use that one to promote health. The Thyroid Day, the People with Disability Day, the Drug Abuse Day. All these are geared towards promoting health, but the best conduit to implement that is social media, because it's where the youth are. And in Africa, we have 65% of its population, it comprises of youth. Out of 1.5 billion people, 65%. But in the EXA region, we also have between 60 to 65% of its population, which is comprises of youth. So because youth are the main users of social media, are the ones whom we can strategically invest to make sure that we promote health through those platforms. Next. Social media is a tool for professional innovation. Issues to do with crowdsourcing, health solutions, and feedback. You can do it through social media. Promoting digital health apps. For instance, in Kenya, Uganda, Malawi, even Tanzania, the OBGYN professionals, they have the WhatsApp group to help those who are working at the lower level or primary healthcare level to consult the seniors who are in the tertiary and secondary level when they encounter the emergencies. So they use that, the WhatsApp platform, and it has been very effective. You find people are responding 24/7 whenever there is any emergency, and this is the use of the social media. Hackathons, digital health communities, collaborating, sharing ideas through online communities is where you can innovate. And this is what we want, that we need to embrace use of social media to be able to address challenges, but also to promote health, to advocate for health, but to also innovate a number of things. So the telemedicine, using the WhatsApp or using all these social media handles, you can deliver whatever information you want. You can consult. Now, there's innovations that are coming out. One of the innovations, doctors, they can consult someone through social media platform and to inform the patient or the client if there's a need of that client or a patient to visit his facility, or you can be prescribed through the social media. So now there's evolution in healthcare industry. People are changing practices time to time to suit the generation that is existing right now. So there's no longer that, no, you have to do this and that. Through innovations and through the social media, you can deliver a number of mentorship programs. I've been having mentorship with average of 10 to 15 people per year, and I use social media to be able to deliver my mentorship to those people. So only maybe after 2 months or 3 months is when I can use, we can have physical encounter and have discussion. The best practices and ethics for health professional online, and health professionals, whether through social media, blogs, virtual consultations, or public education, we need to practice carefully whatever we do through social media. And we need to be ethical. We need to maintain professionalism, but we need also to have trust, and also we must conserve the patient confidentiality. So now some of the ethical considerations, the issue of autonomy, respecting others, or respecting users to make informed choices. And we need not to manipulate. Beneficiaries, we share content that truly benefits and empowers the audience. We as professionals now. Non-maleficious, avoid harm. Now there's a lot of bullying going on through social media. Justice, to promote equitable access to health information and services. The issue to do with digital divide must be addressed. Accountability, to own the content and correct errors publicly and promptly. You shouldn't wait for any other person to correct that. Next. Now, maximizing impact. What strategy do we have? You need to choose the right platforms and content styles. And this is where now the challenge is. We have the Instagram, we have X, we have all these social media platforms. But you should be able to know what content and for what social media. Otherwise, you end up having some problem. There are places where it's just for socializing, not anything serious. If you post something serious, people are not interested. So you need to identify that one. But also monitoring the reach, the feedback, and community interaction. Every now and then you should be able to analyze and know that how many people are following, what and that has been going on, why this time people are not very forthcoming, what is not right. But remember, your post is your brand. So whatever you post, you must know that is a brand. Next. Benefits and opportunities. Through social media, you have greater accessibility and inclusivity. You will have personalized health messaging, community building, and peer support. But again, it's low cost and high impact reach. You find someone is having a very small bundle, but can transmit a huge message that can impact people's life. Next. Challenges and risks, privacy concerns. So issue of privacy is quite very imperative. We need to make sure that whatever we are doing, confidentiality of the people, that's why other people need to seek their consent before you do any posting. Misinformation, disinformation, that is also one of the challenges and risks. Digital divide, the urban and rural, and access to issues, but also the ethical considerations, which I've just mentioned in the two previous slides. Next. Current and the future of the social media. Now, most of the social media are AI-powered or algorithm-driven health content. We need to take care of that. Now, one can promote health, or can advocate, or can innovate using Canva. You just program you are posting that every Tuesday or every Monday or every 3 days, I need this information to be delivered throughout the year. So AI is coming one of the very important tools in the social media platform. Virtual influencers and healthcare bots is very important. Now we have influencers who are blending the social media and they are very popular, and they also make influence in health promotion, advocacy, and innovation. So when we use social media wisely, we should be able to influence social behavioral change. More regulation and health information standard. Why we need regulations? Due to the fact that there are people who are abusing the social media. So, or they use social media for bullying and other things, but also increasing role in global health diplomacy. With global health diplomacy, you need a lot of communication, and you need to use different approaches and platforms to be able to deliver messages to different audiences. So with global health, the social media is highly needed. That's why you find all these CEO at the global level, regional level, they use social media to deliver their messages to different groups, especially the social groups. Next. So in conclusion, my takeaways: let us use social media responsibly for good health. I repeat, social media is not just a tool. It is a movement in health transformation. And social media is not just to have a likes or dislike, but it's a lifeline. Thank you very much.
Wow. Thank you so much, Dr. Ntuli, our senior, for the informative and engaging presentation. We are truly appreciating for the insight you have shared and the effort you have put in delivering this topic in a very clearly and very understood way. So to capture some of the issues that Dr. Ntuli has presented, we have seen how the powerful of social media and the role of social media, and how can we use social media in the different angles, like in health promotion, health advocacy, and health innovations. But also he has talked about our best practices. So it is crucial we follow the best practice and ethical guidelines to maintain professionalism, but also social media can help us to gain the public trust. But also we have seen the current and the future social medias that we have seen. And it's a call for action for all of us. We need to use social media to improve our health, but also it's transformative. So this presentation highlights how social media can communicate. It is a tool, but it's very powerful, driving change in advocacy, in health education, but also innovations, as Dr. Ntuli said. So we need to use it to gain empathy, like to raise our voices. So now the audience, the floor is yours. If you have any questions, we are going to take some of the questions, but before that, let me welcome Ibrahim, who will be also the discussant in these discussions. So our voices can make a real impact. Ibrahim, karibu.
Asante. One moment, please. Sorry. Can you hear me now? Hello? Hello? Hello?
Dr. Ntuli, let me take over. I think Ibrahim internet is not good. So in the chat box, we have some of the few questions. Maybe Dr. Ntuli, you can respond before Ibrahim take over. So this is Mufate admin. He said that, does your journey influenced by the social media? Is any sharing story can be learned from your milestone? And how can we minimize the risk while using the social media? Dr. Ntuli, if you can respond to that. Dr. Ntuli. From the participant, anyone who has a questions, you can just raise up your hands, or you can just write your messages in chat box so that we can read. Anyone who has a question, Dr. Ntuli, are you around? Okay. Dear Don, karibu. Then we'll go to Kizito.
Asante sana. Nilikuwa naomba kuuliza kutoka kwa presenter kuhusiana na presentation. Amesema kwamba unavyokuwa unafanya health advocacy kwa kutumia social medias, lazima pia ujue content yako and relevance kwa platform ambayo unatamani kuitumia. Sasa nilikuwa naomba tusaidie kwa kushare insight yake, which platform suits for information most, kwa sababu kaona kwamba a lot of youths tuna prefer, na mimi nikiwemo, kutumia Instagram, and a lot of them pia na prefer kutumia TikTok. Sasa yeye labda kwa kutumia experience yake, kwa sababu anaonekana ni user mkubwa wa hizi social media, hasa kwenye health advocacy, anaweza ka share insight na sisi kuhusiana choices kwenye hizi social platforms na information relevance.
Thank you so much, dear Don. I have not that questions. Kizito, karibu.
Yeah, thank you so much, Somoy. Thank you so much for the opportunity. Actually, I wanted to ask you, Dr. Antuli, a question regarding his position in a health industry, because he's leading Eastern, Southern, and Central Africa health community. But specifically, I wanted to know regarding the context of health promotion via social media. Among the impact or the hard part of social media utilization, especially in Tanzania, we have a problem of I call it a social media divide. So I was thinking, like, considering digital divide in rural areas in Tanzania, how can social media now based health promotion can be more inclusive in countries like our own motherland, Tanzania?
Oh, thank you so much, Kizito. And Dr. Antule, are you back?
Yes, I am. That was okay. Go ahead.
Yeah, I just wanted to give you a brief on these questions. Maybe you didn't have them correctly. So we have one question in the chat box. It say that, does your journey influenced by social media? Is any sharing story can be learned from your milestone? And how can we minimize the risk while using the social media? That was one. And then we have another question. Alikuwa najaribu kuulizia kwenye health promotion advocacy. Umesema kuna some of the sites ambazo watu wanaweza kawa wanatuma their relevant story. So can you try to share what are the relevant sites wanaweza kupitia au kutuma their content concerning on health advocacy? But the other questions was from Kizito. Najaribu kuuliza, we know in our context like Tanzania, issues are health promotion.
So moderator, please use English. We have colleagues from Zambia, Eswatini, and yes, please.
All right, so sorry.
Yeah.
Okay, that's good. So as a director of general of the East Central and Southern African Health Community, so they say that they need to know your experience, and especially in rural settings, how can we make this inclusive, the use of social medias and health promotions? And the other questions was concerning, can you share your experience on the site, the relevant sites that they can use to share their content? Karibu, Dr. Antule. Dr. Antule?
Thank you very much, and I the media, but yeah, can you hear me? Hello, can you hear me? Can you hear me, Prosper Alois? Can you hear me? If you can hear me, wave. Yes, yeah. So people can hear me now. Maybe moderator, now you need to.
Yeah, now we can hear you.
Which you have. Yeah. So thank you very much. So what I wanted to say that indeed we have a digital and social media divide. But as time goes by, what we have learned, there's a massive investment among the governments in our member states in terms of the internet and the reachability of populations from different parts of continent Africa. And that's has helped a lot. But also the use of gadgets like the smartphones, it is on increase, both in urban and rural, which provides an opportunity for the people to be able to enjoy use of different platforms of social media. So in my journey, I would say that as a public health specialist and the global health advocate, social media is one of the tools to be used to make sure that you communicate whatever information that you have. Because in the end, for instance, if you are into preventive medicines, health promotion, and advocacy, then if you do not communicate, it means you're in the wrong area. That area requires someone to be able to communicate. For instance, health promotion, for you to promote health, you must communicate to the public so that they should be made aware what to do and what are the best practices or health practices that are needed for them to have healthy living and also to get rid of diseases. The physical activities, health eating, all these needs different forms of communication. So public health communication, it is very important. Now, as time goes, generations evolves. Now the mainstream media is more of those who are above 50, I would say so. But with the young generation now, they're into social media. And if you do not have the segment of population, you do not make a segment of different population groups, then you end up having a very good message that is not reaching the target. For instance, now we are talking of the youth mental health initiatives. I cannot go with that advert to the radio. If you go with it to the radio, then you are preparing yourself to fail. I'll take that one to the WhatsApp. I'll take that to Insta. I'll take it to X. I'll take to those platforms that the youth love most. So this is something which is important. But if you stick, no, we used to have radios. Now we will go to the radio, and now you can hardly see youth actually listening to the radio. So you have to, and even those radios, again, those youth whom they listen to, you know, there's this brand, and that brand. And the radios, you'll never find a youth listening to that. Or the youth in the urban setting prefers a certain radio, a certain television channel. But in the rural, you might find also they have certain channels and that broadcast certain things where youth prefer. So you need to understand, to study your audience, and then you segment your population, your audience, based on the suitability of the channels of communication. That's why you find there are some of the social medias, you find there are people who are not interested completely in certain social media platforms, simply because they know my values, my other things, they do not belong to this one. So they'll be running away from that one. But again, there are social medias just for socializing, making people laugh. But there are social medias where serious information are delivered, are communicated, and people that would prefer to go to that. And my experience is that as a public health or global health expert, you really need to use the social media to communicate. But the caveat to it, you really make sure that you do your homework. And your homework is whatever information that you post or you deliver, it has to be supported by the science and other things, especially for the platforms that you use for health promotion. Health promotion, one word, can confuse and can mislead people to start doing or practicing bad behavior. So you have to do research.
Dr. Antuli,
You
you're
need
breaking.
to go. Then I'm going to talk about mental health.
Dr. Ntuli, you're breaking.
Can you hear me now?
Yeah, now we can hear you.
Okay. So what I wanted to say that can you hear me now?
Yes, we can.
Yeah, I had to resort to use my phone because my computer, I think maybe I have some weak internet here. So the message I wanted to communicate there is that it is very imperative for us to choose the media handle or platform carefully, so that whatever we choose, it should be aligning with the agenda that we want to deliver. But also the technicalities of delivering messages is also very important. You cannot just use one tactic to deliver. So you have to make sure that you'll have to make sure that you choose the right media to deliver that message. If you want to use artists, comedians, or whatever, again, the most important is the content. Because with social media, you are the content creator, you are the content analyzer, and everything. But up to at the level where you can now decide maybe I need 2 or 3 people to help me out. But still, even those who helps you to do anything in the social media, you have to make sure that you check on them all the time, because otherwise they might also deliver something that is going to ruin your name. As I told you, any post that you do or any posting is equivalent to a brand. So any post has to be carefully looked at, and the content in that post has to be really that is professional and that is needed in the area of health promotion, innovation, as well as the area of advocacy. So even if you ask people to handle a social media, but you need to find a mechanism that you'll be checking on the content that is being posted. And if it doesn't resonate with what you are doing or your values, you should be bold enough to say, take out that one or drop that, because that is doesn't represent my values and doesn't represent what I'm standing for. Can we have another round of questions?
Thank you so much, Dr. Ntuli, for responding very clearly. And now let me take this opportunity to welcome Mr. Enoch as a keynote speaker. He's the president of Tanzania Society of Pediatric Nurse, who will bring an insight and experience a discussant to this session. Dr. Enoch, Mr. Enoch, karibu.
Thank you. My name is Enoki Diocres. I'm a pediatric nurse, and I'm the co-founder and the current president of Tanzania Society of Pediatric Nurses. And also I'm the founder and manager of Tanzania Sexual and Reproductive Health Forum. I take this opportunity to appreciate the big job you have been doing, the Moffat team and the audience. But I want to take this opportunity to appreciate the presence of Dr. Ntuli, Director General of East Southern Africa Health Community. Actually, myself, I'm not good public speaker like Dr. Ntuli. So now you have to start to struggle, because I can't deliver the the speech like Dr. Ntuli how he's been doing, but I will try my best. Actually, I have been learning a lot from Dr. Ntuli. You can appreciate his work since we have been struggling to make Dr. Faustin to become the director of WHO. Then after that, we come to Professor Janabi, so you can appreciate his contribution. It was outstanding. So I will take this opportunity to discuss a little bit about social network and profession. Dr. Ntuli has discussed a lot of things about COSI social network. So I will myself, I will talk more about the professional in a social network. So I will start with a question that I will ask this question twice. The first one, I want everyone here in this forum to go back to 2005. What do you see when you just think back to 2005? What can you see? When you talk about information, you can see the old modern screen. You can see the radio. And at that time, we had the portable radio, like the phone. We have the portable radio, which you can, it was very small, and you can put the earphone, then you connect it, you can hear a variety of radios. And this was a reliable place to get the information. From that, we had another place, we call it Vijueni. For the foreigner, Vijueni is a place where we usually, in example in Tanzania, you can find those old people, they just gather there and make some stories while they're just drinking coffee. So this was only two places to get the reliable information. So now 2025, you can take your phone and open your gallery. What do you see? Some people will see, we call them memes. Can see memes. Some people will see the beautiful pictures taken from the different place when you visit. You can see the different videos or the part of the music or something else. So when you go back to the social network, so if you just open, maybe let's say, open your Instagram, Facebook, Twitter, and LinkedIn on your account. If you can see your account, the content in your account and the content in your gallery are the same, so you are in wrong track when it's come on the professional professional social network. You are very wrong. You are in wrong track. So today, now let's move on another thing. You can think about your curriculum. Your curriculum, you can see your name, where you're going to take the different level of education, maybe the number of training, the number of articles which you are among of them, the authors. You can see all this in your curriculum. Now just go into your social network. When it maybe along the Instagram, Facebook, Twitter, and LinkedIn, can you see one which carries that information you have in your curriculum? If you can say it, you can see it, you are wrong. You are in wrong track when it's come the professional network. So today, hyper-connected world. Social media is more than just a platform for sharing photos or trending hashtag. It is transformative force in global health for amplifying the voice of and serve the community to accelerate the speed of life-saving information. Social media has defined how we advocate, educate, and innovate in healthcare. The power of this platform lies in the ability to connect, engage, and inspire action. As we gather here today, let us explore how the digital revolution is not only shaping our conversation, but saving life. So now I have the question. Can you see all across all social networks? When you just see look on all social network, you can realize artists are taking number one to dominate those social network. Look And now just come on the demand of our community. Look on our community. When you go into social network, you will find the storm of wrong information. Wrong information in the social network due to the everyone is just putting the information because somebody is the business, she or he wants to sell his vitamins or the certain medicine. So you can see that there is a storm of information, and we as a health healthcare provider, we don't have the party to just to dissolve this wrong information. We're just taking a step away and leave the community struggling with this wrong information, and we just here. So this is what we lack to contribute in social network. So now we have to think about now let's go to the social network, types of social network. We have the different social network. I heard the questions asking where you can do the promotion, something like that. So we have the various social networks, but we have to divide the social network into professional social network, and I don't know how to call it another one, but when it's come on the social professional social network, it is Twitter and the LinkedIn. So this will find the people who are just doing the advocacy, or we say we have been talking about the curriculum. So curriculum vitae, CV. So you will find yourself, you have to find yourself curriculum vitae into the LinkedIn or somewhere into Twitter. So this is a place when you can grow up your career. So now I have a question. Can you just learn? I started by asking the question, go back in 2005. Can you now learn into next 10 years from now, from today, 2035? What do you feel? Can you take the 5 minutes to think about what will happen in 2035? You can see, maybe you can see the AI dominating everything, everywhere. AI, artificial intelligence. You can see information, we call it machine learning, dominating everywhere. Somebody can see robots. I think this is you are thinking in right track. So if you can see those robots which you saw, this might be you in the future. So in 2035, maybe you want to turn into the robot. You have to transform yourself into robot and to suit in 2035. Why? Because you need to do a lot of things. So most of us, we have been investing only in the we call it in routine thing. For example, today I saw one of our colleague is midwife, and now she's a member of parliament candidate. So she's preparing for herself to be among of the candidates who will be in the parliament for the next 5 years. So I tried to find her in social network. I didn't get any information of her. I found in her name in Instagram and in LinkedIn. So you can see she is the right people. She's the right person, but you can find out that there is no place where we can be amplified. For example, we as maybe as she's our colleague, this is our opportunity to support her. If it's in a social network, we can make it go viral, and some people we know about her. So it will be the easy way. So because we have been living in a routine, and when you go back onto our teachers has been learning from the teachers of 19s. So there was out of this digital life. So we're in digital life. So in 2035, you might need to turn into the robot. You have to be the healthcare provider maybe, and you have to know about AI, you have to know about the social network, how you can engage with the people, something like that. So this, I wanted to talk at the introduction of what I might talk about the social network in this part of our profession. So I wanted to highlight a little bit about the praise which we can use the social network. We can use the social network in health advocacy. Dr. Ntuli demonstrated a lot about this. We can use it into health promotion. Dr. Ntuli demonstrated a lot about this. And also we can use it into innovation. This it can increase the speed of innovation. You can put if it is and maybe you need to find somebody or the group of people who have idea about certain innovation. People will start to compete, and you will get a lot of ideas about the health innovation. So now I just want to move. I don't want to talk about much about that. I want to move directly on how you can have the impactive social media account. Especially, I want to talk about having the Twitter account, having the LinkedIn account, and about Instagram, Facebook, TikTok, or YouTube. These are very famous, and it has been used by a lot of people. But this, for example, when you wanted to, I want to talk about HPV or about another vaccine, HPV vaccine or another vaccine. If I want to communicate with those what we say about the elastic consumer, I can use Facebook. I will get everyone there in Facebook. You know, in Facebook we have even the groups. We have the groups. You can find the groups called maybe the groups from the certain area. For example, we have Mabag. What we have Mabag Lilapsi. Let's say in Kagera. So you will find there is a group of the people who are living in Kagera in Facebook. So this is the advantage of social network. So the social network are different. So when if you try to think that the social network are the same, you are in a wrong track and you are lying to yourself. If you want to talk about we call Gen Z, Gen Z, the people, the young people, you will find most of them they are in TikTok. So you can deliver there your information. You will get all the Gen Z. In Instagram. There's these social network are different. So we have to appreciate that. And when you are planning to have intervention and you have to disseminate, or you have to disseminate the information, you have to think about which social network you have to use. Maybe I think we have to take this one maybe to Dr. Ntuli to call up in our universities, in our colleges, to have the module out of the session, which will help those upcoming S provider to be capable to use this social network to give the information. I said about the storm of the wrong information. People that are doing business. So you can find even in Tanzania there is no professional site which give the right information in our language in Swahili. If you go Kenya, they are using English. In Uganda, when you deliver something in English, it might be it might has an impact than in Tanzania. Tanzania we are using Swahili, so you will find those information in Swahili are the wrong information or are for the business information. But we have a lot of association. We have the government. Government always try.
Hello, Mr. Enoch. Hello, Mr. Enoch.
Hello.
Yes, Mr. Enoch.
Are you there?
Yes.
Yeah, can you use 3 minutes to end up your presentation so that we can continue sharing the testimony of the use of social media?
Okay, thank you. So the last part I wanted to talk about how to have the impactive account. So if you want to develop how you want to grow up your professional account, you can use LinkedIn and you can use Twitter. So what you need to do, you have to make sure that you are in the certain platform, which is, if it is LinkedIn or it is Twitter. This is the most professional social network we have in our area. You have to put put it clear why you are in certain social network, but also you have to have the valuable content. You have to have this content which can attract another or the same profession or something or somebody want to be attracted to your content, and you can connect or you can do something maybe which is product in future, but also is consistency. You can have the account today, you get today, then after 3 weeks you come back. So this is in a social network, we call social network algorithm. It will clear you out. People, they want you won't be visible if you are not consistent. But also if you are just if you have the professional account, you have to put if you put the image, maybe your photo or something else, you have to, it has to be clear. It has to make it look very professional. So another thing is to engage. Somebody post, you can repost, you can give the comment, or you can give a site. This is how to have the impactive account, but also credibility. Credibility is very important because people who are just sharing maybe your content or something else will look on your credibility. This is you cite it from somewhere else, or you are giving the liable data, something like that. And the last one is adaptability. So you have to be updated. You have to find the means you can find on the Spain account, for example, for the WH account or something or another account. There is a place where you can put the alert. Once they just post something, you can get it immediately. So this can help you to be updated. So this is all about, I want to talk about how to have the impactive social network. Impactive professional social network. Thank you. I really appreciate this chance. Thank you, Mofate team.
Thank you very much. Madam Today, are you here?
Wow. Thank you so much, Mr. Enoch, for the very informative discussions. We appreciate your time and your expertise that you are able to share. Now, Dr. Ntuli, are you with us?
Hey.
Great. So we are going to take a couple of questions, and we have some of participants, they want to share their testimonial through social media. So we have
Yes, I'm here.
We have one question from the chat box. It says this: how can we change people's minds to believe that they can get a lot of knowledge through social media rather than physical? So Dr. Ntuli, you'll respond to that, and then we are going to take another hands from other participants so that they can ask.
Can you repeat the question? Can you repeat the question?
Okay, it say this: how can we change people's minds to believe that they can get knowledge, health knowledge, via social media rather than physical approach?
So again, promotion, like what you are doing right now, the Moffat, is that you inculcate the culture where people, they'll be used to have meetings, discussions through these platforms. Now, physical meeting is becoming one of the past practices, although they are also important. But again, today in this platform, we have colleagues from Zambia, Eswatini, Zimbabwe, and Malawi that have been very expensive to convene such a meeting if it needed us to meet physically. So with this type of platforms through social media, it's low cost effective. So people that have written me now of SMSs in my inbox that we need a repeat of this one, and also we need to have more of tailored discussion.
Dr. Ntuli, are you there? All right. Now, while we're waiting for Dr. Ntuli, let me welcome James, who's going to share the testimonial.
So, in conclusion, to my side, is that we really need to embrace this, but the most important is having the people, especially the youth themselves, to decide which topic they think is important to them at this moment. The social media, most of the people underestimate the power of social media. They don't think anything about the social media, but this is a tool most of the Western countries, the global north, are using it. All the leaders, all the mid-cadre level practitioners are using it because it is an effective way to reaching out to majority of people, but also to promote health, to promote, to advocate for health, and also to speed up innovation. And this is one of the very effective way to doing so. So what we should do now is to having a very organized way to ensure we do have this type of conversation time in, time out. This is what I'll say for now.
Great. Thank you so much, Dr. Ntuli. Now, let me welcome James, who will be sharing a powerful success story about the impact of social media in health advocacy. James, over to you.
Okay, thank you so much. My name is James Joseph. I'm an SB professional, but I've been working on social media as a social media manager, and also I'm a marketing officer from Nilax Home Based Care. So I'm great honor to get this opportunity to share a success story about social media. The first of all, before you get into social media, you have to learn you to understand why are you getting into it. And learning is not about knowing the Facebook, Instagram, TikTok, Thread, Twitter, or other platform. You have to understand how you're going to use the algorithm, because if you get into Instagram and start perusing or finding some stuff which is not what you want, algorithm will prefer to bring that stuff to you. So if you're looking for something good, it's going to be good to you over the all. And the second thing before you get into social media, I would love to share is about knowing why are you there. Some people, they are there because they've seen some influencers, some social media, some public figures. So you have to understand the main reason why you get into it. Why are you getting? So you have to understand the main objective. Maybe on Instagram, I need to get there because I want to connect. On LinkedIn, I want to get there so as to expand my professionalism. On Twitter, I have to get there with specific objective. That is going to easier your journey of social media. And the second thing is, the third thing is about the target. On social media, we have small community, depend on what you want. If you're a nurse, you want to connect with global nurses, because all over the world, every nurse have social media. So if you get into to make that, you want connection with different nurses from different area of the world, you understand your objective. So you are going to get that because it's your objective and it is there. So knowing the algorithm of social media is going to help you to achieve what you want. You might think like some people, they get jobs, some people they get scholarships, some people they get a lot of stuff, some people get a lot of issue because of social media, because they understand how the algorithm work. And the next thing is your content. People will come to your profile, they don't know you, so they come to see what you're posting. If you're posting about food, they believe that this person loves food. If that person is not interested in food, is not going to be on your site. So if you want to make like my social media to be a professional on all platforms, being professional is not being on Twitter, on LinkedIn, which people prefer. Like if I want to be professional, I have to post on LinkedIn, which is sometimes I would love to say is not true, because if I'll post all my things that are professional on TikTok, on Facebook, on Instagram, everybody will follow me because they have seen that thing there. This person is professional. This person, I can learn something from him. So other nurse, as the social media manager, I would love to share the testimony that social media are the great opportunity to everyone. It depends on how you use them. For example, for me, as I work in NILAX, which is dealing with home-based care, we obviously provide how the home-based care is more beneficial to people. So if someone passed to our social media, like if you go to our platform like NILAX home-based care on all platforms, you come to learn about the benefits of home-based care. So all the people that have been following us in our platform, like Facebook, Instagram, TikTok, even on our website, which is NILAX Healthcare, is they're going to learn. So all the people who are in there, they get the opportunity to understand how home-based care is dealing, how home-based care is operating here in Tanzania. So that is my short story. I would love to get the opportunity for others also to talk. Thank you so much, Madam Somoy.
Wow, thank you so much, James, for sharing a success story on Instagram. Now, let me welcome Mr. Moses. I'm going to take hands for questions so that Dr. Ntuli can respond to them. So we're going to take a few hands, then you respond, then we're taking another round. Moses, karibu.
Thank you very much. We have shared a lot of issues concerning with the social media and how it is applied in our real life. So one of the questions I want to ask Dr. Ntuli, how do you see for the next 10 years to come on issues of social medias? Can we be left aside as healthcare professionals because some of us we are not sometimes believing on the application of this one? But also, do you see within 10 years we can be having a step aheading on the proper use of this social media? So I want to hear some of the reflections from you based on this one. 10 years to come, how do you see social networks in our country or in our nation in general? Thank you.
Thank you so much, Mr. Moses. Meshach, over to you.
Okay, thank you very much, moderator, for good moderation and for having seen my hands. Before I ask that question, I just wanted to thank Dr. Ntuli for good response to the question which was posed, which I really like the question. How can we change people's mind to believe that they can get knowledge via social media rather than physical and something like that? For sure, this is the most important thing that we need to adhere to and put in our minds, because always people's mindset believe that valuable knowledge can only be acquired through social media. It is sometimes is true, but for them now to believe on that, it requires several things that we need to take into place. And one of these is to build trust through credibility. How do you make them this social media to be credible so that people can believe in it, that it can help in imparting knowledge? Because if we don't believe, for instance, if the information that are gathered from the social media seems to be untrue, then it makes people sometimes to think that sometimes social media is not a correct way of acquiring knowledge. So for us to do that, it means we have to engage those people who are mostly respected in the community. If we involve the community people who are much respected in to understand that social media is one of the approaches that can help us in understanding or in acquiring knowledge, then this can be better, as well as using the expert. For instance, in a case where you want to use a social media and you involve an expert, then an expert can explain it in a clear way where that people can really understand it in a simple manner and believe that for sure is the best way rather than the physical. But also what we are doing now, giving these short case success stories, they are also very much important in making people to understand and accept social media as the best way of acquiring knowledge rather than this. We have also use of influencers and community leaders, as I have said before. But I had one question, or I have one question. The way we are moving now, and I can see artificial intelligence is becoming much, and I believe it's one of the social medias, and we can't refrain from it. And I'm unfortunate I didn't introduce myself. I'm Meshach, one of the nurse tutors at Bugando in the Mwanza College of Health and Allied Sciences. I've started to realize the diminishing of critical thinking in our learners. And most of our learners, when you ask that question, they straight away go to the AI, artificial intelligence, and Google the answer, and they don't think anymore. So my question is, if we really cultivate this artificial intelligence, don't you think in the next 10 years we are going to have a population who cannot apply their personal critical thinking? Instead, they will depend on this artificial approach, in which when this approach will collapse, then we'll have brainless people in the community. That's my question. Thank you so much, the moderator.
Thank you so much, Mr. Meshach. Now, let's hear from Baraka. Over to you. Baraka, are you there?
Okay, thank you, Baraka Maglan.
Okay, proceed.
Okay, can you hear me?
Yes, we can.
Hello?
Yes, we can hear you.
Okay, thank you. Okay, thank you very much. First of all, thank you, moderator, and thank you for Dr. Sorry, remind me his name.
Dr. Ntuli.
Dr. Ntuli, for amazing speech. Sorry if I mistaken the name. I just have some few questions that I wanted to ask. But firstly, want to congratulate his tremendous story and I mean lecture that he has taught us about the artificial intelligence. But I had some few questions that I wanted to ask, and one of the questions that I wanted to ask is like, how do we maintain scientific accuracy without losing audience engagement or comprehension? That to ask is, what are the reliable methods exists to evaluate the true impact of mass media on public health outcomes? And my last question is, and we have platforms, tones, and format work best to reach and influence youth. Okay. How do we, what, what are the exactly what are the reliable methods? I'm sorry, I wanted to say, what are the strategies that can unify messages or any information that we want to deliver to reduce the public confusions that we are in the same professions, and we want to deliver the message that cannot confuse the audience or the consumers. We want to deliver the message and we want people to understand it clearly. We are not the same. I may deliver, or perhaps I may deliver a message that may confuse the audience. So this is what my question I wanted to ask is the way that we can, the strategies that we can unify the messages to reduce the public confusion. Thank you very much.
Oh, thank you so much, Baraka. Dr. Ntuli, are you there?
Yes, I am, and I really appreciate those questions. Are very, very good ones. Maybe to start with the question that was asked by Moses, the issue of how the social media will look like in the 10 years to come. I must tell you that the speed of evolution of social media is fantastic. And whoever is denying the social media right now will be left behind, and it will be very difficult to catch up. Very difficult, because the world is changing and the world lives in eras. There's era, old stone age, So this is the era that embraces social media. And you need to keep up your pace with the current social media speed. Otherwise, it will be very difficult. But how the social media is going to look like is going to be more powered with AI. I can see AI being part and parcel of the social media. Now we have the Canva, one can program something. We had the colleague spoke about the algorithms that are necessary to drive the social media agenda. So the social media will evolve, and it will be something that will be widely used by many. Now, you spoke the issue of how do you make yourself uh, relevant to the speed. I think you need to update yourself with different handles. There are handles which you say, no, I cannot keep with this one. Maybe it will be too much for me. But maybe for 3 or 4, maybe I'll move with this one. Or for these 2, I'll be able to move with them because I believe they'll be beneficial to what I'm doing. And then when it comes to how do you position yourself, it's ensuring that with these professional social media, whatever you post, it should be professional. It has to represent you. That's why I told you that whatever post that you're making, it is your brand. And that is what will ensure that people will view you as a credible source or non-credible source. That's why I have a couple of people whom I follow them very close. The World Health Organization DG. He posts every single day. We have Jean Kaseya from Africa CDC. Those to name few. We have the World Bank president. Those are the people, time in, time out, they post different stuff. So you need to go, and when I read whatever has been posted there, I take it as a pronouncement. I take it as official. I don't need to go anywhere else to start reading what has been spoken by Tedros, the Director General for WHO, or Jean Kaseya from Africa. I don't need, because that will be time wasting if I go elsewhere and try to validate the information that have been provided. So this is what I want us all to be like. You go, you do your homework, whatever information that you give out there should be educative, should be to promote health, should be to advocate for health, and should be to accelerate innovation. And when we do that, everyone will be actually looking after the post of the other to see what new information is coming out. So that's very, very important. When you speak, you post something that maybe is accompanied with numbers, you must be sure with the number that you are posting. And we know the sources, the credible sources where you can have all the information that has been validated. The WHO is one of them, the Africa CDC, now EXA, Health Community, for the projects that is implementing in its 9 member states. EXA can provide you that information. For instance, next week we shall be having the virtual focus group discussion on youth mental health matters within the EXA region. That when that is out, then you must be sure that this is a credible source that has provided that. So I thought that is very important. So whatever we are posting, we have to be sure that the information that we are sharing with others, it has been tested, it is credible. Now the issue of AI, my dear, AI, it is there to stay. Or in other language, AI is our necessary evil. We must embrace AI. There's no way you can run away. Now, even our teaching for those who are educators has to change. You know, the teaching that we used to have in 1950s, 1980s, or 90s, or 2000 has to change because AI is there. Now, people that will be tested, their critical thinking, not how much they can put into their head or claim. You need to change the approach. So the challenge now in the education sector, how do we actually change or evolve to be able to match up with the AI and other things? But if you want to say, no, you cannot use AI, you cannot, that will be the past. Because now in Europe, and even some of the countries, some of the schools in Tanzania, in Kenya, Malawi, and other countries, they have that as one of the modules that is taught, and now they are teaching them how to effectively use AI for you to solve various problems which you have. So that poses a lot of pressure into our education system because we were not prepared to have that. But it is already there. Now we need to see how are we going to live with AI. And the other question was the issue of reducing the public confusion. You know, when you know this is a credible source of whatever information that you want, then you want to be confused. And that's why we are using social media. We had a huge challenge with vaccine against HPV, vaccine, the COVID vaccine. We had anti-vaxxers who spread a lot of wrong information. But it was through social media when some of us we took some photos being vaccinated and that we are not changed, we didn't change into zombies. It's when the public started to trust because it wasn't easy because those people they spread a lot of wrong information to the public that was confusing. But up until when we said yes, you can do that. So as the issues to do with the blood donation, there's a lot of myths about blood donation. That's why sometimes we donate blood and we take photos so that to erase some of the misinformation that seem to be confusing to the general population. And when people they see you 2 months after blood donation, a year after blood donation, then they change their mind that no, this is something which I can also be part of. But up until you use social media, you post your photo while you are donating blood, you post your photo while you are doing some physical activity, is when people started trusting that yes, even the medics themselves, they're promoting and they're part of that. They are also innovating, they are also advocating. So this is something which we all need to do as the public health, especially so public health personnel or global health advocates to ensure that those who are not in the health sector, they should be able to get trust from us. But in what the content that we are posting should be the post that is appealing to all people, not only the medics. And that's one of the challenges when it comes to the use of social media. When you are posting for any health promotion material or any advocate material, try to use a lay language so that it can be appealing to both medics and non-medics. Otherwise, you find the community of your followers are just those who are in the medical field, which is totally wrong. You need to have people outside your field for you to be able to educate, for you to be able to promote health, for you to be able to advocate, but also for you to accelerate innovation in the health sector. So you need other professionals from other disciplines to be part of you. So this is what I can say for now. Thank you.
Thank you so much, Dr. Antuli, for your thoughtful and well-articulated response to the questions. We truly appreciate the insights that you have shared. Now, let's open for another round of questions. Please feel free to share your thoughtful or raise any quarrels that you have. Now, let me take over. Joachim, over to you. If you have any questions, then Diadon, then Kizito, and then we'll end up with Mufate. Joachim, karibu.
Okay, thank you, Madam Moderator. I am Joachim Kilas, a Mofate Conference Manager. I was contacting with one of the discussant, who is Ibrahim, IT technician of Mofate. So he shared some inputs on its area. The first point is through social media, we reach youth everywhere with no limits. So through pages on Facebook, WhatsApp groups, Mofate has helped to teach students and young people who cannot attend physical training at once. So even those who live in scattered areas receiving their training, they were able to access the materials and get the same knowledge at the same time. So another area, free and paid session that everyone can join. So we offered both free and paid sessions through Mofati Academy. So which is linked with all social medias which are commonly used by the society. This helps everyone to access the knowledge, learn some better ways to deliver health services, also the community to benefit from those sessions that were provided through social media. So the IT skills was integrated in those projects. So another area is correct health information, especially on education, and easy way to access through social medias. With our TikTok and Instagram Reels, we share short and simple health tips, which are easy to be memorable, like how to prevent a certain disease, or we can take an event from a health calendar, and then we create a poster which is easily to be memorable from those who are following, and get the knowledge from those posters. So another area, connecting health expertise directly with the community. So we believe that community extract the knowledge and benefit through social media. So we make it easier for all healthcare practitioners to be directly linked with the community. So we conduct a live session. Say one of the area that we effectively utilize is live YouTube streaming, where the community can follow the live session which are progressing and can benefit, also can contribute from what is going on. So another area, last but not least, is a safe way to share information. So the IT department, it makes sure that the data are protected. So every information which are being shared are being considered in the area of privacy and the consent to share with the audience, so we can protect the personal privacy, spacing, social medias, and the I can say the right of person to decide on what he or she is sharing to the community through social media. So after saying that, back to you, Madam Somoy, the moderator, at your end, please. Thank you.
Thank you so much, Joachim, for sharing that. We acknowledge it. Now, dear Dawn, over to you.
Okay, thank you so much, Mr. Moderator. First of all, I would like to appreciate what has been presented by our facilitator, that is Dr. Antoli. But I wanted to ask, as previously asked, that can he share his experience in the choices of social platforms in response to the information that are being shared? As we know that most of the youngsters do use TikToks to share the comedy contents, but here we are in the target of sharing the health advocates through the usage of social platforms. Now, can he try to share with us his experience in the use of these social platforms in relevance to the information being shared?
Thank you so much, dear Don. Accompanied to that, Dr. Ntuli, we have another question. It's what type of social media is more professional networking so that people can use it? And now let me welcome Mr. Moses, then Kizito. Moses, over to you.
Okay, the only thing I was looking to add on those materials that have been shared by Dr. Ntuli, specifically on the 10 years to come, I have been appointed, I have been called by the Minister of Health to prepare the facilitator guide and the student manual for nursing and midwifery students, NTA level 4 to NTA level 6, more recently. So one of the things we have agreed, all of us, is that we can't avoid the AI and the other materials that are supportive, especially platforms, digital platforms, but also the digital devices, to be known by the students before even going out from the school. So what we have seen and what we have done is just to incorporate, while they are taking the computer course or module, they have to go through the AI. Also, we have integrated the AI in their learning materials, but also we have integrated the digital platforms, but also we have integrated the digital devices. That they have to know those issues before even coming out from their institutes. So I think this is a better thing and a better move, and I really appreciate the Minister of Health for looking this one as one of the great advantage for them, because we can't learn away from these realities. If they are going out, means they have to know the issues concerning with these areas, and we expect those products that will be coming out just after the reflection of this, all the integrated materials. We can say that now some years to come, most of healthcare professionals, they'll be able to integrate all the issues in the social media. So this was just a point to add on Dr. Ntuli said on these platforms. But moreover, to speak loudly and to say that we have the community that have a diversities perceptions based on these social medias. So I can assure, and I can even concur with Dr. Ntuli, that we need to abide with the principles and ethics when we are going to apply and to use these social medias, especially to dissemination of the information. There should be approved, or there should be having the cited evidence-based practice corners of proved evidences, so that the nourished community, or the nourished professionals, they'll be able to verify if the material that have been sharing within the social medias, they are taking the realities based on their living or real life living, and also they are basing on the evidence that we have in our healthcare. So what I can say on this, maybe sharing. So the product or student that are coming from here now onwards, probably they can be having the chance of knowing those issues while they are at the school. So they'll be knowing the social medias at the school and how to integrate the AIs into how to search the informations and how they can abide with the principles and the ethics based on our country. So thank you very much. I was just looking to share this because I think this one will be one of the way to build up our community to be healthier, and also to base on the ethics and the principles when they are applying the social media with the integration of AIs. Thank you very much. Yeah, thank you.
Thank you so much, Moses. Congratulations on this remarkable achievements. Kizito, over to you. Then we are going to Dr. Ntuli. Karibu, Kizito.
Okay, thank you so much, Madam Simone. And I appreciate for sure the presentation that Dr. Ntuli made so far. And I stand also on the side of my colleagues who raised their questions and their remarks. But I am getting a lot of questions around this matter, specifically because of the presenter that we have, that is a key person who plays a prominent role in EXA region. But I'm trying to think, like, what are the guidance or regulations that exist at the regional EXA region to help healthcare professionals advocate responsibly on social media? I wanted to know this, but again, I'm trying to think, like, what control do we have for non-professional people, non-medical people, who plays part also in posting some of the medical informations in their social media? People who are not medically oriented, but they are doing that. So I'm trying to think, like, what control does the government in the member state, in EXA region, do they have in making a proper control of the post of medical related content in social media from people who are not actually the medical personnel? These two questions for now.
Thank you so much, Kizito. Dr. Ntuli, you're now welcome to respond to some of the questions that has been asked.
Thank you very much. Thank you very much. And indeed, again, these were very pertinent questions that has been asked, and I'm glad that this topic has sensitized people to come up with so many questions that are very relevant to what is happening today. And with the first question on the experience that I've had, really, for me, I have about 4 handles. I don't do TikTok, though I do appreciate most of posts in the TikTok. And maybe I also ask some colleagues, maybe if we can work together and try to have a TikTok account so that we can have some very short messages that can be shared to promote health, to advocate, and also to try to accelerate innovation. So this is an area which I welcome whoever is interested. Maybe you can work together and try to see how we can handle that account. But I have the YouTube account, although again, I do not have much of the followers, but it's where I do post a number of health promotion materials, but some updates. I remember during the campaign of late Faustin Dugulile and Mohamed Janabi, whom I had a privilege to serve as campaign manager, I used my YouTube channel to be able to post some of the videos, those videos which they were actually expressing, and also trying to share their manifestos for the regional directors post. So I have been using that one. And when it comes to my experience, well, I prefer much the LinkedIn is where I do most of my postings, but I am in the Instagram, X, or which we used to call Twitter, but I'm also one of those Facebook. I know Facebook is old school, but I never stop posting things there because it's where I started my social media journey. So I make sure that my followers in Facebook remain abreast of what is happening in the health industry and make sure that they know the number of health promotion and activities, as well as the advocates of things that do around that area. And when it comes to the what social media will do, especially in the area of East Central and Southern Africa community, we at the EXA we have 11 colleges. These are the colleges without walls, and people do attend through distance. But also we have constituent colleges and hospitals where they go for practicum. And through these colleges, they have also some modules on AI and social media. But we also want to review to see if they're in keeping with what is happening right now, because one of the challenges I think they had recently, it was some of the students, they did use the AI trying to get some of the information just prior to the exam. So they want to see how do we integrate the AI to be part of the modules that are taught into these colleges. So we have the College of Public Health Physicians, and soon we shall be having College of Psychiatry, and we want to have also the College of Primary Healthcare, as well as College of Nutrition. So in total, we might be having up to 17 or 18 colleges. And we make sure that with the new colleges that are about to start, we have the social media modules, the AI, and other things that are very relevant to our current situation. And for non-medical, the mandate lies with the Ministry of Health and the medical council of individual countries. If a non-medical, even a medical, posts something which is controversial or contravening to the government efforts, then the Minister of Health should be responsible either to put a fake or to take that person to the court, because when you put a wrong information, that is not freedom of speech, especially in the medical fraternity. You might confuse everything and you're going to be counterproductive in some of the investment that have been put by the governments. So we make sure that we take appropriate measures. I remember when I was serving as the Director of Preventive Services and also the Director of Health and Social Welfare and Nutrition Services at the President's Office, time to time, I reached out to the people who were posting the wrong thing and asked them to drop them, because that was the. And most often, you find when you reach out to them, they'll say, "Oh, we didn't know this. So can you give me the right information?" I give them the right information, because sometimes with this world which we have, which is AI powered, there can be a lot of misinformation. But it's up to us as professionals to ensure that our platforms remain relevant. But if, for instance, one of you reposts or retweets some of the information which is not sure with, then you are also part of the problem, because we are expected to be providing the right information. And this is how we can promote health, how we can advocate health, and also this is how we can accelerate innovation. And there is no any better way, like you have the wrong information. I've seen even in LinkedIn, some of the people that post the wrong information. I'll try to inbox them. If they don't do, I go to your page, I post the right information, because you cannot allow someone to be misleading others, particularly on the issues related to health, nutrition, or social welfare. If people get wrong information, then you might find that whatever we are doing is counterproductive, and we do not want to go to that level. The issue of digital media and health, we have now, even at EXA, we want to start a college now. I think that's going to be one of those 17 to 18th colleges that we emphasize to have. That's College of Public Health Communication. So I'm trying to mobilize some colleagues and folks out there so that we can work on that area. Public health communication is one of huge potential, but yet we do not have people who communicate health. That's why you find some of the people, they'll go out there and speak some of the things that deem to be confusing to the general public, because they do not know how to communicate health, particularly to the lay people. Because here we aim the public, not the medical fraternity. So we really need to learn how to do that. So I've reached out to a couple of colleagues, and if I told there be any person who want to join that movement, I'll be happy, so that we can start the process of registering that on as a college. That you start with the module, then secondly you go to another thing, up until when you get it registered. And this is very relevant right now. The people like Ibugusi, Syriacus, those are the people like Kuduishe, Kisolwe, the people like Norman, Jonas. Those are the people who've been trying to a level bit to communicate health matters. They need to be supported. We need many of those kind, and so that we can be able to really have a professional way of communicating health matters. And if we have professionals who communicate health matters, then the issue of using social media to promote health, using social media to advocate for health, and using social media to advance innovation, it becomes very simple. So we need very few change makers who join the movement, and then we'll have many people joining us in ensuring that we deliver the right information to the people and to contribute to the social behavioral change, but also to have improved health outcomes and a well-being. I'll stop there.
Wow, this is great. Thank you so much, Dr. Ntuli. As we close to the end of this inspiring session, I would like to sincerely thank our speakers for the valuable insight shared and all the audience for your participations and thoughtful questions that we have been asked. So your engagement has made these sessions very truthful and very meaningful. So before we close and I hand over to Mufate team, I just want to leave you with this. Social media is not just more than just likes and shared. It's a powerful tool for changing. Each of us has ability to use our voices, whether to advocate, whether to educate, or to inspire our community or our country. So whether you are a student, you're a professional, or you're a businessman, I know a lot of us have been joining today from different kind of diversity. So let's today's sessions be a reminder that our voices matters whenever we go. So thank you so much for being here and for being part of this movement. So with me, Somoy Mohammed, a head marketing of Nilax Home Healthcare. Now let me welcome Mufate team for a closing remark. Thank you.
Okay, thank you very much. Thank you very much. Thank you very much for these wonderfully sessions that we had today. So we extend our heartfelt gratitude to everyone who joined us for the impactful sessions on the power of social media in health advocacy, promotion, and innovation. These sessions actually brought together healthcare professionals from across various disciplines to reflect on the transformative roles of digital platforms in reshaping health communication, advocacy, and also innovation in 21 centuries, where we are. So I sincerely thank our esteemed guest speaker, Dr. Ntuli A. Kapologwe, the Director General of the East Central and Southern African Health Community, for his visionary insights on regional collaborations and the strategic use of the social media in driving health equity and policy reforms that we are hearing from today. So our deepest appreciations also goes to Mr. Enoki Diocles, President of the Tanzania Society of Pediatric Nurses, whose keynote addresses highlighted the power of professional voices and the community-driven campaigns in advancing health and public engagement through digital platform. So we also are equal grateful to our session moderator, Ms. Somoy Mohammed, the Marketing Director and Project Coordinator at Nilax Home Healthcare, for her excellence facilitation dynamic coordination that guided the sessions with clarity and engagement. So special thanks goes to discussant Mr. Ibrahim Nsemwa, the head of IT team at Mobile Facilitation Team Mofate, whose valuable technical support and contributions helped frame the role of digital infrastructure in sustaining online health movement and professional networks. So lastly, as Mofate, we wish to extend our sincere appreciations to all healthcare professionals and the participants who took their times to attend, actively engage, and contribute to the success of these sessions. So the presence and the participation reflects the growing commitment to empowering digital tools in shaping the future of health advocacy, education, and service delivery. That's what we are doing always. So together, let us continue to innovate, influence, and inspire through social medias as we build a healthier and more connected global community, and also asking the East Central Southern African health community through Dr. Ntuli Kapologwe to continue taking to cooperations the Mofate in driving some of the agendas that aligns with our digital investment. So by saying this, I wish all the best and have a nice night and good day for all of us. Thank you very much for being together for a time.
Thank you so much.
Thank you very much.
Thank you.
Thank you.